question maybe for the women who are from legal backgrounds, and then also a couple of you are on the boards of Catholic nonprofits or affiliated with nonprofits, but in the instance that the HHS does not change its position and this continues to move forward, and let's say Obama is reelected and they don't budge, legally, what's going to be, how will the dominoes fall? And then can those of you who are on the boards of nonprofits or affiliated with Catholic nonprofits, can you talk about what your office is? Has there been an initial discussion about what you'll do? Will we see civil disobedience, or will you close your doors? Can you talk kind of in concrete terms about how this will play out if, in fact, the exemption is not broadened and HHS doesn't budge?
Just to speak to the legal perspective, as things stand, and frankly, even the promises of compromise don't look like they're going to materially change anything. If this mandate continues, I think what you'll see is first something that Dr. Anderson predicted, which is that you're going to have a large number of Catholic organizations that are getting out of the healthcare business altogether, because it's going to be even harder than it already is to be able to practice a type of healthcare that's consistent with Catholicism. Unfortunately, you're going to see a lot of religious organizations and religious individuals that are going to be faced with really the untenable choice between facing crushing fines and having to engage in civil disobedience. Because even if you happen to be below the level where you get fined for not providing this healthcare or not having it for yourself, you still have to break the law to do so. You will be in violation of law if right. For example, your business wants government contracts and has to be able to sign something saying I'm not in violation of federal law. You can't do that anymore if you are not providing this healthcare. So there's all sorts of reasons it's going to really destroy that. We're already seeing a big invasion into various careers, making it very hard for people of faith to operate in them. There are cases that are going on right now that have gone both ways, actually, in terms of pharmacists being able to operate if they don't dispense contraceptives and abortifacients, and in terms of psychologists, if they're able to even practice if they aren't willing to put a stamp of approval on same-sex relationships. There's step by step. There are avenues that are being closed off to Peace Bill of Faith in America. I have a friend whose parents came here from Indonesia specifically because their children didn't have the full range of options because of their ethnicity and because of their religion. They weren't able to get any job, and they said, we want to come to America so our children have those options and can be part of any career they want to. Unfortunately, that part of the American dream is being closed off if people of faith are being shut out of these careers, and I fear that that's going to happen if we see this continuing. So we're going to have to see some kind of either massive civil disobedience, or it's just going to be, or we'll see, unfortunately, people of faith rolling over. I don't think that will happen. But you'll see things like the Catholic Charities is already out of the adoption business in many states, and we're just going to see the Catholic Church is going to have to be out of the healthcare business, and then maybe even out of the employing business, or there's just going to be out of the being financially stable business.
I would say for our 4 clients, 3 universities and 1 business, the fines for 2 of the colleges would actually be so crippling that they would have to close their doors. And for one of the universities, Belmont Abbey College, the president has said that he would much rather close the doors than fight and provide this. So there is some hope in knowing that there is a university out there that's willing to say, you know what, I am so opposed to this that I will close my doors. But for the businesses that can carry on, if they do pay these fines, then unfortunately they become undesirable employers, because who doesn't need health care? I mean, we're looking at one little itty-bitty part of it for large families or small families or someone who has an ailment. When you have your employer health care, that's the only way that you cover pre-existing conditions. So there's a really big issue there for these employers. Even if they do manage to keep their doors open, all of a sudden, no one's going to want to work there. So there is a little bit of hope. We recently won a case in Washington State where there were 2 pharmacists and 1 pharmacy that didn't want to dispense this, and they were contraceptives and the week after pill and the morning after pill. They've always worked through a referral program, and we managed to get an exemption for them. So there is some hope there if you're willing to be brave enough. And Thelma and Margot and Ralph's Thriftway were brave enough to say, I can't do this, and I will get fired, and I will close my pharmacy. And the moment that these these businesses that are a part of a community shut down, even people that don't necessarily believe in this or that aren't necessarily a part of this say, hey, wait a minute, this is my neighbor, this is my friend that I grew up with, and they're good people, and I'm going to fight for them. So we have to have a little bit of hope in that as well.